Dear colleagues, let's start this exciting symposium on something absolutely new, from pause to play. Nothing is more related to the name of the Society of Menopause and Andropause, and now we have to play with another new issue, which is the concept of Doublepause. If I can go, okay, wonderful. Let me make a little bit more close to you. And those are the disclaimer, and this is the agenda. My name is Emmanuele Jannini, and I have the great pleasure to have a wonderful faculty of Professor Nappi, Professor Schrödinger, and Professor Giraldi. And I would like to introduce a little bit our speakers. Professor Nappi is a very well-known professor of gynecology in the Pavia University, close to Milano. And she is a great expert of psychoneuroendocrinology. And also I have to tell you a secret of Rossella, because she likes very much to write the next very intellectual movie to win the Cannes prize. And I'm definitely sure that she will do it. Katrin is a German gynecologist. She's also president of the Academy of Menopause of Hamburg. And she's very expert in gynecological endocrinology. And I have also a secret from her. She likes tremendously to be part of the Pippi Longsong Nordic Saga. And finally, my friend Professor Giraldi, Anna Maria, despite the name, she's living in Copenhagen, but she's Italian in origin. So we have a majority of female and a majority of Italians, actually. I am the unique male, and Katrin is the unique German. And, well, we can say that Anna Maria is definitely interested to write the next chapter of the Harry Potter saga. And again, my name is Emmanuele Jannini. I'm living in Rome, but I'm teaching also in several universities in China as well, in Vietnam. And my dream is to be, as all the Italians, a singer in the Italian opera, which is unfortunately something which is outside my possibilities. So let's go to the first presentation, which will be my own one, if I can have it. Okay, so this is my organization. It's called Endosex. We are dealing with endocrinology and medical sexology in the University of Rome Tor Vergata. Those are my disclosures. We are facing, my colleagues, something very interesting and very new. The fact that this pyramid, which is also present in the underdevelopment countries and in the developed countries, is changing completely in the shape. In the few years, we will have a percent of population so old that it will be the same as the young population. In other words, if we want to take care of the health, and in particular of the reproductive and sexual health, which is the main issue that we have to discuss today, we have to face this kind of revolution, demographic revolution, particularly important. Also because there is another thing which is coming together, is the fact that we have to admit that we are using not so good a lifestyle. And our lifestyle is impacting tremendously in what is making andropause and menopause, sick andropause and sick menopause lifestyle. The lifestyle and the comorbidity of the climaterium with the non-communicable chronic diseases, the five families, if we wanted to take also depression within the non-communicable chronic diseases, oncological, cardiovascular, metabolic, and respiratory, is such things which is making worse the climaterium, the menopause, and the andropause. So we have to take care of it, because we may impact through the sexuality in order to improve the lifestyle of the couples facing it. It is the idea of this acronym I used. SM means SM, which is not sadomasochistic. Maybe you can think about it. It's not the case. SM means system medicine, which is the part of medicine dealing with the non-communicable chronic diseases, and the sexual medicine with a huge power in order to interact with the couple, to change the lifestyle of the couple in order to decrease the risk of non-communicable chronic diseases. Pfizer, many years ago, did this very huge and fundamental survey around the world, showing how deep is the effect and tragical is the effect of aging, non-cured aging, non-cured, not treated menopause and andropause into the sexuality of the people. You can see in male problems in the ejaculation, problems in the erection, of course, tremendously age-dependent condition, but also hypoactive sexual desire disorder and the lack of orgasms. And in female, of course, there is the same picture, lack of sexual interest, but also difficulties, hormone-dependent difficulties in the lubrication, absence of pleasure, absence of orgasm, which are coming together with the pain during the penetration, which is one of the most challenging issues that the gynecologist is facing when dealing with the menopause. But also we have some other data. This is another classic work, which is demonstrating actually that the couple in menopause and andropause who are making sex, able to have sex in the older age, are more healthy. So in other words, if you wanted to understand which is the canary in the mine for the general health, ask to your patient how is the sexual health. Nothing is explaining better the general health of the couple, the general health of the people, than the sexual activity for plenty of biological and anatomical and physiological reasons that we may discuss later in the discussion. So when we are putting together the menopause and the andropause, now let's go into the concept of the couple. In fact, the sexual symptoms are, of course, coming from one member of the couple, but they are also going into the other partner, coming back, amplified. And this is tremendously important because, for example, if the male partner is having erectile dysfunction, she may understand that she is the reason for the erectile dysfunction, and this is lowering the desire of the female counterpart. This is a typical mechanism that is always seen in the patients, in the couple with this, and there are also something anatomically and physiologically to consider the fact that the possibility of the man to have, just for a representation of it, to have the so-called, what we call the lost penis syndrome, where the anatomy of the vagina and the lubrication of the vagina may impact on the ability of the male penis to maintain the erection, which is due to the feedback coming from the glands of the penis and the friction, which is very important. This is just a representation of how the couple may produce it. And this definitely impacts on the relationship. In this article I wrote together with my friends here in Florence, Mario Maggi and company, we demonstrated actually how it is dramatically impacting all those things where, as androgynes, of course, coming from erectile dysfunction as well, hypogonadism, but that this is impacting into the physiology of the vascular physiology of the penis, but also the frequency of the intercourse, and this is impacting in the couple as a whole. And this is another friend from Taiwan, Professor Jiang. He was able to demonstrate how the couple is acting, for example, in the case of the female partner, the impotent female, the impotent partner, who is a nickname I'm using with my patients in order to show that she is also having a lot of impact, of course, of the erectile dysfunction, and can be measured using the most popular psychometric tool, which is the female sexual function index, producing the erectile dysfunction producing worst levels of this very popular psychometric tool. And this is another instrument that I really suggest you to use as more as possible. To considering the couple as a whole, I published this cartoon in the Nature Review Urology in order to demonstrate that, of course, where there is no dysfunction in both members of the couple, the sexual situation is completely satisfactory, but where there are some levels of a subclinical dysfunction, I will be back on it because it's tremendously important for the daily clinical life. There are completely different conditions, and the satisfaction of the couple can be tremendously affected, as it is, of course, when both members of the couple are having an overt sexual dysfunction, which is producing the absence of the sexual life and the sexual health. But What's happening in the real life? Usually, despite the fact that we are together, endocrinologist, andrologist, and of course a gynecologist, usually the female patient is going to the gynecologist is making a good diagnosis and a good therapy, but not involved with the partner. This can produce a lot of conflicts because her vagina can work, but his penis is not working if nobody is taking care of it. And of course, it is the same if I'm treating my patient with successful drugs, but I'm not considering at all that the penis should go somewhere, and if the vagina is not working properly. Of course, I'm simplifying everything, but you can understand how important it is to share the diagnosis, to share the treatments within the couple, having the couple as a unit. And that's the reason why, with Rossella many years ago, we decided to give a name to this condition. And we found that the possible name is a couple pause. And now that the concept is having more success, the concept couple pause, which means taking together the menopause and andropause in a whole and sharing diagnosis and treatment. However, there are both pros and cons in the concept of couple pause. That's the reason why we have now to face some novelties that I want to introduce. The benefits is definitely that we are focusing medically in the couple, that we are meeting unmet needs of both the patients and the doctors, and we are focusing on the reality of the patient who is experiencing the changes due to the climaterium, and we are establishing the partners and the relationship, how it is affected, and sharing therapies and improving communication and the collaboration between the doctor dealing with male sexuality and doctor deal with female sexuality. However, there are some risks. And for example, the term couple pause can be perceived in English as a pause in the couple, which is not the case that we are actually facing. The couple is there. Otherwise, we are not discussing about it. And also, the couple pause is maybe containing some kind of heterosexual perception, which is not a unique one. We are now dealing with a lot of patients who are homosexual, both for menopause and andropause, and definitely considering this issue, it needs another term. And there is, in fact, a possibility to have unwanted and non-inclusive aspect of the term couple pause and the oversimplification. So, thinking, we were now deciding to have another term. And the term that we may propose to you, and I'm really curious to have your reaction about it, is the term double pause. Double pause means that when you have a sick menopause and when you have a sick andropause, the final effect is not the sum of both. It's something else. It's the andropause times menopause. So it is an amplification that we call the double pause. Double pause means that there is a sick menopause per sick andropause, because the symptom is coming back amplified from the partner. And this is also true in several conditions, also of course in what we call the homo double pause, where there is a double menopause in the case of lesbians, where there is, in the case of guy, a double andropause. And again, those symptoms can be times two and resulting amplified, coming back from the partner to the patient having the symptom. And the couple is definitely tremendously important. As endocrinologist, of course, I'm dealing also with metabolism, and in particular in this article, we demonstrated that a very typical non-communicable chronic disease, which is gout, not so much studied, but tremendously frequent, can be really affected by the lifestyle within the couple. So, in other words, if in the couple you are able to change the lifestyle, this is acting as an anti-inflammatory effect in the other member of the couple. And this is true for smoking, this is true for metabolic condition, and all the non-communicable chronic diseases which can be modified according to the lifestyle. So the double pause, my colleagues, is a new taxonomic paradigm which could be considered very useful in the clinical practice in order to treat the climatic sexual dysfunction within the couple. Having a couple pause, a double pause has two terms, and the new one, the double pause, is encompassing all the issues, the sexual issues coming within the couple, also considering what is tremendously important, the relational issue. I think that this is my last slide in order to go smoothly to the other speakers. And definitely the aims of this new concept, for the first time I'm introducing, thanks to the faculty, that we discussed a lot about this term. And we are sure that now having the double pause is a very nice, smart way, a clever way to investigate the partner's role in the management and in the treatment, in the diagnosis and the treatment, to understand that any treatment which is improving lubrication, for example, and the vaginal health, let's say, has not only beneficial effect on the woman, of course, but also in the partner, in the male partner, or in the other partner. It is the double pause is tremendously important because it is a way to understand that a successful drug improving the erection has also beneficial effects in the other member of the couple, male or female, in the partner. And also, the double pause is a way of communication about the importance of the lifestyle within the couple. Just to say something personal, when my wife, many, many years ago, decided to quit to smoke, I was smoking for a few months. But at the end of the story, having her not smoking, she didn't tell me anything about. This was just the representation of a good choice. And so I decided, because, I have to say, not because I was afraid of the diseases, you know, the doctors are usually crazy, but I was afraid to do something wrong with respect to my wife. And so I did quit the smoke. I never used to smoke after that, many, many years ago. And it is very important, the couple pause, the double pause, in order to recognize the impact of the chronic illness and to also to address something which is not usually discussed, it is the aging and the climaterium of the homosexual couples. Thank you very much for your attention.